in the developed nations, the life expectancy has increased. People live longer. And because of that extra years that we are living in the developed nations, there is a higher incidence of Alzheimer. Alzheimer is a disease of the old age, starts somewhere after 65 or so. So what happens is that in the developed nations, Alzheimer is one of the most costly diseases. Why is it most costly? Alzheimer is dementia. Person forgets, does not know what is going on. In case of that situation, in case of dementia, you need to have a caregiver associated with the person for long term, till I think till the death. So that cost of care becomes very high. So this is one of the most costly diseases. So one of the reason that this is most researched, number one, people are living longer, so the quality of life should be better, and number two, it is a very costly disease to work with. So now what is the problem here? So before I actually just tell you the definition of what are the symptoms and signs of the Alzheimer, why not we actually see very quickly how Alzheimer affects the brain, and from there you can actually, as a medical student or a doctor, you yourself can tell what are going to be the problems. So here is what happens. If I draw a hemisphere here, so in this cerebrum, what you will see is the progress of Alzheimer. Alzheimer starts from hippocampus. It starts from hippocampus. So this is an area somewhere over here, hippocampus, and it goes up and starts from hippocampus. Hippocampus is important, so I'm going to put that here. This is really important. Hippocampus is important for making new memories. Making new memories. So what happens now is that the patient who is developing Alzheimer, the very first problem that would appear is the problem with the memory. Now what kind of memory? Can the patient not recall? No, the patient can recall, although in the later stages his recall would also start becoming bad. But this is making new memories, that is anterograde-amnesia. Anterograde-amnesia would occur. Why? Because all new memories are formed through the hippocampus. The events or the things that we need to store, they go through the hippocampus. You can take that as the door to the new memories. So because of that effect over there, the anterograde-amnesia occurs. Number two, then the progress of the Alzheimer is called as centrifugal from center outward. The progress is centrifugal, so that means it goes like this progressively. Now if you were a PhD student, I would say that neurofibrillary tangles, they move out in centrifugal, and senile plaques, they move in as centripetal. But that's not important here. This is important, that the disease progresses in a centrifugal way. So what would happen next? So here are the motor areas, sensory areas, speech areas. So the next area that gets affected is the speech area. As the disease keeps progressing, the speech is the next thing that gets affected. Then keep going. If you keep going towards the frontal lobe, that is more devastating, then you would see that the mood swings would come in, mood imbalance would come in. So now you're observing a patient, and he started with the memory problems, making new memory problems, and then you saw that the patient is now having problem with the speaking, or he's developing aphasias of various kinds. Then you saw that the patient's mood is imbalanced. These are all the progressions of the disease, because the degeneration in the cerebrum is also going from the hippocampus outward. And finally, when the frontal lobe is fully involved, then what we say is, what is the function of the frontal lobe? It's the personality, it is us, it is the decision making, it's the way we are. So the executive functions are destroyed. So what is the most important function there? Decision making. So this is the disease. So now you can actually say this is a disease that causes dementia, anterograde memory formation, dementia disorientation, causes the problem with the speech, then mood imbalances, and then the decision making. But here's the thing, a student would just say, well, Alzheimer would cause following 4 things. No, an excellent doctor would know that this would actually be a progressive behavior, progressive signs or symptoms of the clinical aspects. Now, how does the death occur? What happens is, number one, caregiving is needed. You can actually see that as soon as from the memories to the speech to the mood, the caregiver's need will increase. Finally, what happens is the cause of death in Alzheimer, most common cause of that death are, number one, recurrent infections, and number two, so caregiving is needed, recurrent infections, and dehydration. Again, because the patient is bedridden, patient cannot take care of his own needs, he does not even know that he needs to go drink water. So dehydration and recurrent infections, pneumonia like infections, would ultimately cause the eventual death.
Guys, thank you very much for watching. Make sure that you like this video if you like it. If you don't like it, then do unlike. Like this video, subscribe to the channel, and please share this channel with others as well.